Hello, I'm Dr. Dimitrios Kostopoulos, co-founder of Hands-On Seminars, and I have with us today Dr. Kevin Okamura, Senior Faculty of Hands-On Seminars, founder of the program Certification in Advanced Manipulative Therapy. Kevin, how are you?
I'm doing great, thanks. How are you?
All right, awesome. So just tell us a little bit about you. How did you start physical therapy, and what was your interest about physical therapy to begin with?
My interest, I think, was probably stemming from my days just playing sports growing up as a kid.
What type of sport?
Soccer, volleyball, basketball, golf.
Any major injuries back then?
Ankle, definitely some ankle, some hard tackles. Shoulder, I ended up having shoulder surgery a few years ago, I guess. But mostly it was kind of like seeing teammates get injured, during the course of play, and all of us sort of standing around not really knowing how to deal with it. So I was always kind of interested in being able to offer some assistance and help and not sort of feel like I was kind of this useless bystander when teammates got hurt. So that got me kind of interested in physical therapy as a profession.
And you studied in Canada?
Studied in Canada, the University of Alberta in Edmonton, Alberta, Canada, home of the Edmonton Oilers, of which I'm a massive fan. So.
And how about the interest in the area of manual therapy?
Yeah, the manual therapy interest really started as I was going through the program, I think, when I was going through the program at University of Alberta. I had this vision of how I wanted to be as a therapist, and it was someone who could really make a difference with my hands. So when I finished the program, as most new graduates often feel, I felt not that prepared to sort of take on the rigors of working in a private orthopedic practice. So it really made me pursue a lot of continuing education courses with the orthopedic division in Canada. So I achieved fellowship status in the Canadian Academy of Manipulative Physiotherapy.
Which is a big deal.
Several years of training for sure with that, hours and hours of practice, and it was a process. It probably took 5-6 years for sure, at least, to get that process done. So with that, the idea was I wanted to feel like I could offer the most to my patients, as opposed to only being able to offer a narrow scope of practice. I wanted to be able to be the one who could make a difference on several different levels rather than having to refer to another healthcare professional, such as a chiropractor. Not that I'm against chiropractors, but a chiropractor or a massage therapist or a personal trainer. I wanted to be the one who could offer all those services to my clientele.
Exactly.
So
let's talk a little bit about that. The certification in manipulative physical therapy program.
Yeah.
What is different about that program, and when you were developing it, what did you want to give emphasis on?
The challenge with learning any manual therapy techniques, I think, is how technically difficult it is. What I really wanted to emphasize was, first of all, how to perform techniques correctly, but also how to really assess the proper planes of motion. So learning how to manipulate a thoracic spine, for example, is fine, but if you don't know how to find the correct joints to manipulate in the first place, you're kind of flailing in the darkness a little bit. So what I really wanted to do in the program was spend a lot of time going over the biomechanics of the different regions of the spine, how to properly assess and feel for joints that need treatment, how to also assess the safety factors involved with manipulation and make sure that joints that don't need treatment are unnecessarily manipulated. And then I really wanted to kind of perfect and bring people to a real high level of practice and efficiency.
So assessment is extremely important in this case.
Absolutely, yeah. I think that's the biggest thing that I find when I've taught courses in the past. People want to jump right into treating, to technique. They kind of like the idea, especially with thrust manipulations, of getting in and doing something that's really dramatic. But the emphasis on my perspective is really trying to pull them back and get them to carefully figure out why they're applying this technique in the first place. So especially when it comes to regions like the neck, where there's some more safety considerations, assessment is absolutely crucial.
Awesome. And tell us a little bit more about the structure of the program. So for the students who might be interested right now to hear about how the program is structured and what do you teach in each of the modules of the program?
Yeah, so the program design is over 4 different modules. Module 1 is basically an introduction to biomechanics of the spine. So if you've never done anything with hands-on spine treatment, this is getting you from basically that introductory level all the way through to feeling comfortable trying a few basic introductory manipulation techniques.
How many days is that?
So that's a 3-day course.
3-day course.
Yeah, fairly detailed work, but again, so far the feedback's been fantastic with it. The second module is basically picking up where we left off from Module 1. So the hope is that everyone goes, of course, after Module 1 and starts implementing in practice right away. Module 2, they come back, they get a kind of a refresher over the concepts from Module 1, and then we really start to introduce more manipulative skills. So then they finish Module 2, they feel like they've really got some competency gained now. Also a 3-day course. Module 3 is designed as a 2-day course right now. So it's basically looking at peripheral joint manipulation techniques. So grade 5 techniques for the ulnohumeral joint, for example, wrist carpal joints, ankle and foot techniques.
And now, and then there is a module 4.
And there's a module 4 as well. So the module 4 is going to be the certification module. So it's over 3 days. The third day will be the certification examination. Days 1 and 2 in module 4 will be just, again, reviewing, making sure everyone's comfortable with the idea of manipulation, ensuring that they know how to correctly assess, how to correctly manage any adverse reactions that might occur. We'll do some case studies in that. We'll do some more advanced techniques in that. Really kind of consider all the different problems that might arise when someone's trying to do manipulative therapy.
And the feedback we've been getting from the students who are taking your program is that they feel that after they finish every modules, they feel a tremendous level of confidence in performing the techniques and performing the proper assessment. How do you manage to achieve on the course participants that level of comfort?
I think it's really just starting back with an explanation of the biomechanics. So this is what a joint does. This is the way it can move and this is the way it can glide. So theoretically, a lot of people get that stuff, but then when it comes to feeling it, often that transition from knowledge to
right.
hands is really a tough one for people to make. So I really try to get people feeling properly what it is theoretically they seem to understand. So I'll put my hands on their hands, for example, and try to assist them being able to experience a glide. We'll spend a lot of time with practice and nobody feels rushed. There's ample time for questions and explanations are given. So it's really a comfortably paced, not too slow, but not too fast course that I think really is very thorough in the explanations.
Good. Are there any prerequisites for Module 1?
Module 1's got no prerequisites. It's for physical therapists, physical therapy assistants, occupational therapists. So anyone who's interested in manual therapy, I suppose they're allowed to come too. No, that'd be fantastic actually. Yeah, physicians would be a fantastic addition to it as well if they're interested in that world.
And how about Module 3?
Module 3 is also just a standalone module. There's no prerequisite for that at all. People can come and attend and just choose to do that one if they like.
And Module 2?
And Module 2, because it's building on Module 1 will be the prerequisite for that. So mainly it's just because I don't want people to feel like they're coming in midstream and feeling quite lost and overwhelmed. So there is a very linear progression from Module 1 to Module 2, making Module 1 necessary for Module 2 to make sense and be effective for them.
And how about Module 4?
Module 4 will be the final certification weekend, as I mentioned. So the prerequisite for that will be completion of Modules 1, 2, and 3.
The title of the course is Certification in Advanced Manipulative Therapy, AMT, right? And this is a Canadian type of approach. What do you mean by that? What is different about a Canadian approach?
Well,
and what do you try to include in that program?
Yeah, it's a good question. So, as I mentioned, I'm a fellow of the Canadian Academy of Manipulative Physiotherapists, and the schooling and the education I received postgraduate was all through the Canadian Orthopedic Association of the Canadian Physiotherapy Association. So, basically, it's looking at meeting international standards. So what I'm a member of is CAMPT, C-A-M-P-T, and they're a member body of IFOMT, which is International Federation of Orthopedic Manipulative Therapists. So with the Canadian approach, it's basically looking at ensuring that we're, one, thorough in our examination, We're not using higher risk techniques. We're trying to be very safe with a real, mind towards patients' well-being. And I think we're just bringing a thoroughness that incorporates a lot of different schools of thought, but we're not necessarily just doing one approach or another approach. We're sort of bringing a little bit from the world of osteopathy, a little bit of the world of some Maitland stuff, but really, we don't really identify so much with either of those individuals. It's just sort of an amalgamation of techniques, what's been proven. We try to be as evidence-based as possible with a lot of the techniques that we do, and it sort of just comes across as this is how we learn things in Canada, basically.
Good. And how about for students either here in the U.S. or even from some other international locations, but who have a degree here in the U.S., who want to take their board certification, the orthopedic board certification here in the U.S. through the American Board of Physical Therapy Specialties. Is your program helpful to those people?
Absolutely, yeah. I think that if they were to complete the program, they're going to have a fantastic foundation and a real leg up on individuals looking to pursue that path. There should be a real consistency, a real carryover. As I said, everything we're doing is based on these sort of Canadian and international standards, which are also very applicable to everything done here in the United States as well. So I think it would give them a very, very solid starting point for that, and probably an advanced starting point for that, where they'd probably be quite a bit further along than the other people in the program.
Very good. Thank you so much, Kevin.
All right, thanks a lot.
All right.